Back now on Triad Today, and whenever we get the opportunity, we like to drag in the physicians and surgeons and physicians' assistants and nurses and talk to them about their careers because they do just such great work. With me right now is first-time visitor to the show, Olivia Basile. She's a physician assistant with Northern Family Medicine in Dobson. Good to see you.
Good to see you. Thank you for having me.
All right, let's find out some things about you. Tell folks where you were born and what did your parents do, stuff like that.
Yeah. So I was born and raised in Kings Mountain, North Carolina. Both of my parents are pharmacists, actually, so kind of grew up in the healthcare system a little bit. And then I went to undergrad and also studied physician assistant studies at High Point University. Met my husband there, and so we graduated last year, got married, and moved to Mount Airy to start our careers with Northern.
How about that? You're talking about your parents both being, you said pharmacists, right? Well, did either of them sort of push you toward going there, or did they let you just sort of find your way?
Yeah, they let me just sort of find my way. I thought for a while that I wanted to be a pharmacist. I really enjoyed working in my dad's pharmacy, but ended up doing some research and decided to go PA.
That's fine. Now, what excited you about becoming part of the Northern Family Medicine practice? Why there? Because you could have gone a lot of different places.
Yeah. Well, it's definitely an area where there's a shortage for primary care, so I'm excited to extend access to quality care there, and also just build relationships with my patients. And there's a lot that goes into the education piece within family medicine, and that's something that I'm really passionate about. So I'm excited to educate all my patients the best way I can to make them feel comfortable.
Well, I think that's a key word, is comfortable, because people, look, most of us are kind of nervous when we go to the doctor. You know, it's not something you just, hey, I really want to go to the doctor today. That's not how it is. And so it's nice to know that somebody really cares about you and sit and talk with you. So I guess the question is, what is your approach? How would you describe your approach to patient care?
Yeah, so I think every patient should be treated equally, no matter their background or circumstance, and that also kind of ties into how unique everyone is, and treatment should always be tailored and specific to that person based on their health concerns and their lifestyle goals that they have. So just trying to really tailor everyone's treatment and lifestyle changes specifically to them to meet their needs the best way.
Yeah, because, you know, everything, and I can speak from experience being I'm 100 years old, so I can tell you, I mean, you don't just have one problem you're dealing with. There's a lot of rippling things, and so you can't, it's not like a cookie cutter approach to helping. Just because you've diagnosed one thing, it might affect something else, right?
Right.
Why is it important to have a wellness visit every year?
So this is where we basically kind of go over all of the patient's health problems and talk about everything that goes along with their health. And so we check their vitals, we check their blood pressure to make sure that it's under control. We do routine lab work, which looks for things like diabetes, high cholesterol, anemia, and lots of other things specific to the patient if they're having certain symptoms. And then we also do a thorough physical exam, which you can find a lot on a physical exam sometimes. And then we talk about the recommended preventive health screenings depending on the patient's age and their risk factors. And so these are all things that if there is something that would be wrong or abnormal, then we can catch it and hopefully get them treated or get them started on the right lifestyle modifications to prevent any complications.
Yeah, you mentioned blood pressure and high cholesterol, that kind of thing, and I guess the question is, what happens if you don't see a doctor about that? What happens if you don't treat for high blood pressure and cholesterol? What happens?
Yeah, so those things, if they go uncontrolled for long enough, they can always increase the person's risk for heart disease, stroke, heart attack, lots of other complications down the road. And so those things being uncontrolled can also really interfere with the patient's daily activities and how they want to live their life. So it's important to keep those things under control so that the patient can live the best quality of life they can, and just to prevent any future problems from arising.
Good advice, good advice. Up on the screen, you can call Northern Family Medicine at 336-783-8100. You can also visit the general website for Northern Regional Hospital at choosenorthern.org. Olivia, thanks for doing this.
Thank you so much.
All right. And thanks for choosing healthcare.
Yeah.
And, you know, even though you would have been a good pharmacist, but we're glad you're a PA. We'll be right back after this.